Most of you will know about Zoom and housekeeping, but I've left the instructions up there just in case you are new to Zoom. The basics are, if you're new to the network, please open up the chat and feel free. Chat is your way of communicating when the numbers are fairly high, and they're approaching 60 now. So unfortunately, I can't have you putting your hands up and saying quite a lot today, simply because the numbers are fairly high. But use chat as your networking opportunity. If you're new and you're here for the first time, a really big and special welcome to those of you that are new members or new joiners just for today. If there are questions, there is an opportunity after each guest speaker, each presenter will have the opportunity to answer some questions. But again, I'm asking during their presentation, if you think of a question, could you pop it into chat? And then what I'll do is I'll filter the questions. We'll have a few minutes of questions for every presenter, so there will be time for questions. I know that Ruth's got to go a little bit early, and she's the last presenter. So what I would say is Ruth will take a couple of questions and then she's got to leave. So if you haven't had a chance to ask Ruth all of the questions, then please email her direct afterwards. Everybody else will be having a look at chat. So the other presenters will be looking at chat. And if you think of a question for them, please do put it in there during the hour. The webinar will be recorded by my colleague Lynn Dudman. So this is just your heads up. If you don't want your camera on, you're welcome to turn it off anyway. But certainly if you don't want to be recorded, then please turn your camera off now. You can have it live if you choose to. It just allows you to be a little bit more flexible if you turn it off. It's up to you entirely. The webinar and the PowerPoint and any other resources that were sent will be available via the Community First and the Gosport Voluntary Action websites. We have to save the link, and then a colleague, when I say that's the royal we, that's a colleague in Community First saves the link, and then each of them will put that onto somewhere within the websites. So it takes a few days. It will be ready by Wednesday, the 10th of March, possibly earlier, but I don't like to commit my colleagues to that beyond the 10th of March. So let's have a little look at the programme for today. So welcome. I know the majority, if you haven't seen me or met me before, my name's Angela Gill. I work with a number of local charities across Hampshire and the Isle of Wight, and the Clinical Commissioning Group. Some of them Community First, Gosport Voluntary Action, Citizens Advice Hampshire, etc. So welcome today. The programme is going to cover COVID-19. We're looking at addressing inequalities and a response from the community and voluntary sector. That's going to be picked up by my colleague Tim Houghton from Community First. Then we've got an update on the Healthy Homes Action Plan. And I have to say, the presentations for the guest speakers today are packed with really good and interesting information. And that's going to be delivered by Abby Twaits from Hampshire County Council Public Health, Adults Health and Care, and her colleague Rosie Fowler from Hart District Council. Then we've got something that I'm sure you will have seen programmes on the television, or you might have experienced through your social prescribing. Hoarding support in Hampshire, really interesting topic, and some really graphic photos from Ruth Gonsalves, who comes from Abbury. I'm then just going to, really hot from the press, pick up just a few slides from the recent Hanson Isle of Wight Social Prescribing Network survey. Just want to say thanks very much for those of you that took the time to complete it for us. So there's just a few slides, but we'll talk about that a bit nearer the time. I'm sure already you have the 16th of June between 1 and 2 in your diaries, but just in case one or two of you may not, that we'll confirm at the end, but that's the date of the next Hanson Isle of Wight Social Prescribing Network webinar. Okay. So I'm just going to check. Tim, have you arrived? Because I know you were coming straight from another meeting. So I'm just checking that Tim's here first.
Yes, I'm here, Angela. Yeah, good to see everybody. Hi.
Excellent. Thank you very much. In which case, I'd like to hand over to Tim, please.
Thank you very much, Angela, and good afternoon, everybody, and thanks very much for taking the time out to join our network again this afternoon. And for those of you that have attended previous networks, then I just wanted to sort of set the scene for some of the conversation this afternoon. But please do, as Angela said, add sort of comments and questions in the chat, and we'll try and pick those up. So the focus really this afternoon was to start to look at some of the societal impacts of the COVID pandemic on our communities, and particularly picking up the issue of inequalities. Thank you, Angela. So I just wanted to make a few comments by way of introduction, really, and set the scene from a voluntary and community sector perspective. The first thing I just wanted to highlight was the extent to which the pandemic has really exposed some of the fragilities within our communities. On the one hand, we've got communities that have really rallied round, have done nothing but show excellent resilience and community compassion and really helping those that are exposed to some of those fragilities. But it's just really highlighted the fact that the number of people that we've got that don't have extensive support networks, that do rely and have relied over the recent months and year on the kindness and friendship of strangers, basically volunteers who have rolled their sleeves up and helped them, but people that weren't known to them previously, and people that don't have strong family networks or ties that live close to them or locally. And these are just the sheer numbers of people. It's very difficult to categorize people. It's not always older people, but there are some underlying factors that are affecting certain types of individuals that are exposed to some of those fragilities. Often they might have underlying health conditions. There might be people with disabilities. There might be people in our communities who feel that they are different to other people that live close by them and haven't made friends, or that don't have those social networks that many of us depend on and have come to take a little bit for granted. So I think that's the starting point, that we do have fragilities, and as a sector our job is to try and understand those and try and address some of those so that people do get the support they need. I think the other thing that's really been brought home by the pandemic and the nature of the COVID-19 virus itself and the implications as a disease and the illness that it causes, is the factor around, what causes us to have underlying needs and conditions. So the conditions in which we're born, in which we live, in which we work, and in which we grow old, impact quite precisely and specifically on how we feel and act, and impact directly on our mental health, on our physical health, and just our wider well-being. And I think, again, what we're seeing in terms of the impacts of the virus are, yes, the extent to which the illness is impacting on people's immediate health and those that have suffered greatly from the illness or been hospitalised, and sadly, people that have passed away. But it's actually the impact that it's having alongside a number of complex issues on people's particularly mental health, but also those that are already suffering and experiencing some long-term underlying health conditions. And those are the implications that I think we want to try and understand and look at how we can address going forward. And what is often the case is that those most at risk to the virus are those that have multiple factors, that have a range of complex needs and issues. And the correlation between those is actually quite striking. So what we are seeing is that those that are at greatest risk from the health impact of COVID are also likely to be, and it's not exclusively, of course, but likely to be having needs and suffering from poorer quality housing or temporary accommodation, or obviously those that are themselves homeless or at risk of being homeless. Because their housing is poor quality, or as a result of the fact they live in poor quality housing, they're likely to be in some sort of financial constraints and not have money to make the choice to move or to find new accommodation. They're limited by the accommodation that's provided for them, which may not be satisfactory and may be contributing to the situation that they find themselves in. And those directly impact on mental health. So we've certainly seen families that have struggled living in unsuitable accommodation, with children being at home. It's one thing getting by when children spend some time at school, but actually living day in, day out with children is causing some quite significant difficulties. We've certainly seen people experience mental health needs. And we've just again exposed the extent to which people are living in isolation. And that, I do always draw the distinction between loneliness and isolation, and that, you know, just because people live on their own, it doesn't automatically mean they're lonely. But there are people in isolation that, as I say, don't have those support networks that we're seeing and are having to support. And added to that, I think, and there is more work being done on this at the moment, we've got yet the more complex layer of ethnicity and the unequal risk of COVID impacting the BME community and the population. Now, I know in an area like Hampshire, which has still got around just over 10% of population in the BME community, obviously that's higher, it's near 20%, or just over 20%, around about probably 24% in Portsmouth, if you include Portsmouth and Southampton figures. But it's actually a real challenge for areas like Hampshire, where the actual extent and the numbers are quite low, but there are concentrations of communities, and the fact that this illness affects those or presents a greater risk to those populations is something that's a really difficult issue to deal with in terms of engaging with those communities, supporting those communities. And as I say, there is more work being done with Hampshire County Council and with other partners to understand the extent to which that BME community does need support. And the final points I just wanted to make before handing over to Abby and Rosie and to Ruth to tell us about some of the services and the support that they're providing that plays into some of these needs, is just around the way that the voluntary sector generally is able to tailor its support. And I think it's one of the great strengths of the sector, and one of the things that we've seen throughout the pandemic is being able to put those people that need the support at the centre and then wrap around the services that they need that are tailored to their individual needs. So this is about working collaborative organisations, not just treating people as a specific cohort or as a beneficiary, but actually saying our organisation can support in a certain way. But there are other organisations that we might need to bring in with the expertise. So if somebody is suffering from financial constraints and debt and needs advice, there may be other organisations that can provide some of that support. And just at the end of that, I did list a few examples of the sorts of support that's being provided in the voluntary sector. So we've got the services through our wellbeing workers, we've got who are managing some complex caseloads, we've got programs like the high intensity user program, where we're trying to prevent people from regular admissions to accident and emergency departments, and often those are people with long-term mental health needs. They may have drug and alcohol support needs behind those. There's great work that our colleagues in Citizens Advice are doing around picking up people frontline with debt advice and support, but then wrapping around other services to help those families and those individuals, particularly those suffering from the economic consequences. We've got the food pantries across the Hampshire now, not absolutely in every district, but in most districts, which again are very much designed to help people to move on and provide that stepping stone and opportunity to engage with wider support. So that concept of a hub model, where the voluntary sector is very good at bringing services together, so that people only have to access the point of contact in one place, is something that we really are working on. So I'll stop there, because we're going to hear from Abby and Rosie. We're going to hear from Ruth as well, but very happy to take questions and comments in the chat, and happy to pick those up through the conversations this afternoon.
Thank you very much, Tim. Okay, so we've got a couple of minutes. I've just moved on to any questions. So Tim's covered quite a lot of ground. He's done really well in just a few minutes. So I'm just going to pause for a minute just to see if there's any comments or questions that you'd like to make to Tim, and then I'll move on. So I'll just pause for a moment just in case anyone would like to put anything in chat. I'm just having a quick look. Okay, so far so good. Tim, I'll leave you to keep an eye on chat, and I'm going to move on if that's okay. So thank you very much. So I'd now like to hand over to two colleagues, to Rosie Fowler and to Abby Thwaites. Over to you, ladies.
Great, thank you very much. And thanks, Tim, for that really fantastic introduction as well. So I'm Abby Thwaites. I'm a senior public health practitioner at Hampshire County Council and also joined by my colleague Rosie.
Hi everyone, I'm Rosie Fowler. I'm the Health and Wellbeing Project Officer at Hart District Council.
So thanks very much for having us with you today. We wanted to share some of the information from our Healthy Homes work, which started originally with a needs assessment in 2019. And then we spent 2020 working with a whole range of colleagues to implement some of the recommendations. So today we wanted to pull out some of the information that we thought would be most relevant to share with you today. So is housing important to health? Well, yes, absolutely. So housing is more than just having a roof over your head. It's essential to living a full life. So we all need somewhere that is safe, secure and stable if we're going to focus on our families, our jobs and our health. So these are some documents that I've pulled out. These are just a handful from the last year, and there's been even more so recently through COVID. And this really demonstrates that the relationship between homes and health is being increasingly recognised. So in Hampshire, generally we have a good population, a healthy population, good life expectancy and relatively affluent, but there are pockets of deprivation. The population is also changing. So in the New Forest, we've got the highest number of older people currently, but it's not expected to have such a large growth between 2018 and 2024. Whereas Rushmore is going to see the highest growth in older people. That's about 22% in the same time period. So then looking at the tenure type. So compared to England, we've got more people owning their own properties, which is great, fewer in private rented sector and more people living in the socially rented sector. So Rushmore and Gosport have the lowest number of people living in owner-occupied households, and that may be seeing the same aspects of that pockets of deprivation that we just described. And the percentage of people living in the private rented sector is increasing. So this could have implications on health through limited flexibility in making home adaptations, the risk of poverty perhaps in older age by continuing to pay rent throughout retirement, and also a reduced security in housing. So the eviction bans have been high on the agenda through the pandemic, and we're pleased to see that that's been extended again.
Thank you, Abby. So that was an overview of the demographics, and we're now going to move on to healthy homes, starting with damp, asthma and overcrowding. It's estimated that approximately 23,000 homes in Hampshire have damp. National data indicates that private rented homes are most likely to have damp problems, and this slide shows how this data has been modelled for Hampshire. Damp homes can lead to poorer outcomes on health conditions such as asthma. We can see here that 6.3% of the population of Hampshire has asthma. In terms of what this means for you as social prescribers, without getting into too much detail of a clinical assessment, if you see patients who have exacerbated asthma, it may be useful to think about their home environment as well. For overcrowding, national data shows this is more prevalent in social rented households. There are health risks of overcrowding, which Tim has touched upon earlier. So, for example, impacts on the family, so having enough space for children to play, learn and grow, and more recently, challenges around homeschooling and working from home, which can lead to mental health impacts. And research through the pandemic has suggested that multiple generations living together can result in poor outcomes, and higher density homes can lead to more transmissions of COVID-19. But that's not to say that there's no health impacts of living alone. So moving on to cold homes and fuel poverty. A household is classed as living in fuel poverty, where the fuel costs are above average. And if they were to spend that amount, they would be left with a residual income below the official fuel poverty line. It's estimated that cold housing directly causes a fifth of excess winter deaths in England and Wales each year. Cold homes can also cause worsening arthritis, meaning people may be less mobile, in more pain, and as a result, they may be less likely to leave the home and connect with others. And equally, cold homes can mean that people may be less likely to invite friends and family over because they are unable to keep their home warm. So it's always something to keep in the back of your mind as to the root cause of why someone might be seeing you as social prescribers. And hopefully these images on the screen here look familiar. So Hitting the Cold Spots is the fuel poverty service across Hampshire. Since 2009, there's been a 20% reduction of fires in the home in Hampshire, with a small number of fatalities, which does fluctuate. The Home Office nationally and the Safeguarding Board locally have identified the characteristics of those at risk, which can enable targeted interventions, and you can see those characteristics on the screen here. It's likely that you will come into contact with individuals who have similar characteristics to these, and we would recommend that people are signposted to the Hampshire Fire and Rescue Safe and Well visits, particularly those with low mobility who haven't necessarily considered their fire escapes, or they may be unable to check whether they've got a working fire alarm. The visits are free of charge and they're tailored to people's needs based on their health and lifestyle choices. And if you go onto the Hants Fire and Rescue Service website, there's a referral form there.
Brilliant, thank you. So our third chapter looked at suitable homes, so starting with adults with disabilities. So we found evidence that people were sleeping, eating, and maybe bathing in one room. And this is obviously going to have huge impacts on their quality of life, but also impacts on maybe unpaid carers as well. So just like everybody else, adults with disabilities should have choice and control over their lives. But it's reported that about 7% of existing housing stock met the minimum accessibility standards that we see today. So what we can do is raise awareness of the district and borough disabled facilities grants to make adaptations to people's homes. So if you know somebody who's a carer, do they have all of the equipment that they require in the home? Could adaptations be made to support the individual that they care for to be more independent and maybe even reduce that workload on them as a carer? And then we looked at homes for older people. But I think it's really important to recognise that they're a really diverse group. So this can impact their housing need. So there are differences in health status, tenure type, income across older people's groups. They're not like a homogeneous group, but the Centre for Ageing Better have identified 3 key links between homes and health for older people. Cold homes, which we discussed previously, the risk of falls, and the location of the home. So it's always a really big light bulb moment in our Falls Friends talks when we say that approximately 75% of falls that result in a hip fracture actually happen in an individual's usual place of residence, whether that's their own home or in a residential care home. It's not the wobbly pavements outside. So home modifications are one of the most cost-effective falls prevention interventions, but also really important to promote that strength and balance exercises as well. And the location of the home is really important. So are they close to shops, green space, community amenities, for example, which can enable those social connections? So where somebody lives is really, really important to their health. And then affordability. So lack of affordable housing for people on low incomes may mean that they have to divert any expenditure on things like food, education, or health towards their housing needs instead. So once taken into account income, Hampshire property ownership prices were becoming increasingly less affordable. And this is similar to the national trend. So unaffordable housing can mean that communities are less likely to have a mix of people within them. So young people, working age people, and older people. So less intergenerational activity, including the opportunity to have informal care. So if relatives can't afford to live in the same place as the person that they care for, it's going to make that really difficult for them. So we might have limited influence on the affordability of our housing stock, but we can make people aware of their financial entitlements. So a recent case study showed that an individual had to leave their private rented sector housing and move back to living with their parents. That's obviously a huge impact on their whole family, especially that individual's independence. So when they linked to their housing team, they found out that they were actually entitled to a huge amount of financial benefit. And if they'd accessed that sooner, they could have stayed living in their own home. So it's really important to take every opportunity to make others aware of their potential entitlements. And I've included the Connect to Support Money Matters image there, where you can find a huge wealth of information.
Thanks, Fabi. And moving on to homelessness. So national data evidences that people experiencing homelessness have some of society's worst health outcomes. You can see from the slide here, people who are homeless are more likely to die younger, with the average age of death being 44 years for men and 42 years for women. 1 in 3 deaths are from treatable illnesses such as TB, pneumonia, or gastric ulcers, so not necessarily drugs or alcohol overdoses, which is sometimes perceived. And they're 5 times more likely to have unplanned hospital admissions as well. And over 40% fulfill the criteria for shielding in response to COVID-19. Typically, this group of people are less likely to access healthcare services due to various barriers such as organisational or attitudinal, for example. In terms of the number of rough sleepers, statistics for Hampshire are broadly in line with the England data. Since 2010, there's been a 165% increase in the number of rough sleepers in England and a 123% increase in Hampshire. Rough sleeping is the most visible form of homelessness, but there is also the issue of the hidden homeless, so people who may be sofa surfing and not visible to local housing teams, and this has become more apparent during the pandemic. We've seen a sharp decrease in homelessness during the pandemic due to the huge efforts made by our local authorities and partners via the Everyone In scheme. However, there is a fear that homelessness could increase again once we see the impacts of redundancy, furlough, and the lift on the eviction ban hit. When someone is identified as being homeless or at risk of homelessness, they should be referred to their local authority via the districts and borough councils. Some services have a duty to do this, for example, social care, hospitals, or people working in prisons. There is also a voluntary commitment to do this. So even if it's not your statutory duty to do so, it is best practice. And the earlier the housing authority are aware, the better the outcome for that person. Emergency housing can be accessed via local councils as a short-term option. However, not everyone qualifies for this. And there's further information on the shelter website, which explains how emergency accommodation can be accessed. And this is just a quick overview of how poor housing can impact mental health and how poor mental health can impact someone's ability to maintain a home. So research suggests how housing issues were often identified by GPs when discussing mental health. So it really shows the importance to use your MEC skills, so making every contact count, and think about someone's wider health and well-being of the person that you're seeing. And we'd be really interested to hear any common issues that you've come across as social prescribers relating to housing. So please do put any ideas in the chat box and we can take this away to support some of the preventative solutions. And finally, in the autumn of 2020, we promoted a workforce development survey for housing, health and care. And here's what you told us. So formal training wasn't necessarily a priority except for hoarding. And we've got Ruth here today to talk more about that later. There was a need for information on signposting on the particular topics which are listed here. So hopefully we've covered a lot of these today, but we want to remind you of the Connect to Support website for Hampshire, which is an online directory of services and groups in Hampshire which can be used to signpost people to. And following the survey feedback, we also have plans to develop a shared induction offer across multiple organisations. And this will include having a go-to person or organisational champion in each sector for any initial inquiries. We're also looking to develop some different videos which can be used for educational purposes, so things like homelessness prevention. And we would love to invite volunteers from social prescribing to record a video of what social prescribing is and how you can access the support. So if you're interested in collaborating on us with that one, please do leave your details in the chat box and we'll get in touch with you. And we've also been developing a page on the NHS platform called Cahoots, which provides training opportunities, research, and acts as an online forum to connect on any housing issues. So it's called the Keep Well Collaborative. And if you'd like to join that platform, please do get in touch and we will share the details with you. So thank you everyone for your time. That's all from us and we'll hand back to Angela for any questions.
Brilliant. You two ladies have done so well to put so much information into about 20 minutes. That was really, or 15 minutes actually. That was really good. I'm going to open it up. I'm going to have a little look in chat now because there was a lot of information to take in, and I know certainly Angela Gold and myself in Gosport last year there was an issue around hoarding, and we're going to pick that up with Ruth. But housing, the sort of issues that you get, you've really hit the nail on the head. So thank you very much. I'm just going to have a little look. Caroline's made a comment. Housing is one issue being covered by Hart Community Recovery Working Group, and she's got a social prescriber representation on that group. She was wondering, and again, if you could go into chat, Caroline was wondering if other areas are doing the same. One area of concern is the loss of private rented housing in Hart as landlords move back to the area and into their own properties as they're no longer working in the London area. So that's a call to sort of any comments really. We've got Fran that would like a bit more information about connector support, and Brenda I've seen has offered that, so that's great. We've got information from Tim. They've got some really useful information, which is great. So thank you very much for that. Okay. It's fine. Having a little look down. We've got Marzina's comment. Fran's put a good connection again to connector support. We're on to the questions, by the way. You've probably gathered that. Marzina's sharing her experience as a community connector. She's saying that the big part for clients is not being able to afford necessary improvements which are not funded by the OT. For example, steps to their mobile homes, or change their destroyed carpet, or things like that. She's saying it's really difficult to access any funding or charity funds for it. So people are not falling into any particular category. So there's an observation really from Marzina, thank you. Right, so we've got a question from Michael Wight. So the question is, do local authorities have access to independent medical advice about requests for expedited housing? Let's get it right. Expedited housing on medical grounds. Do local authorities have any access? I don't know which one of you would like to pick that up.
I'm not too
sure.
Yeah, I'm not too sure. I mean, I guess they would look at it as a sort of whole multi-agency approach, but we can find out and
okay,
take that.
That's super, Michael. My colleagues will pick that one back up and they'll come back to you. So you remember. So we've got your email. So thank you for that question.
I don't know if Megan Fletcher is on the call. She was invited along from the New Forest District Housing team. Whether Megan would know the answer to that.
Okay, she's Megan, if you're on the call, Megan, please unmic.
Hi, no, we don't. Not that I'm aware of, no.
Sorted. That's the question answered straight away. Well done, Abby. Thank you. My colleague from Citizens Advice in Fareham, Biddy Mayo, she's made just a reminder for everybody that Citizens Advice can help with fuel debt and grants for families. They can outline housing rights and support grants, particularly for those with rent arrears, and in an early referral to Citizens Advice is vital rent arrears. And I think I'm right in understanding that there may still be some of the 100k that's available to help people with fuel poverty as well. So again, through Citizens Advice, contact your local Citizens Advice. Right, just got a minute or two left now. The question from Emma, Rosie, is how does somebody join the Keep Well collaboration on the NHS platform? Do they link with you and then you'll link them up?
Yes, that's fine. I can link you up with the platform. We just need to get permission and then you'll have the access, so we can do that.
Okay, so all requests either through chat, which obviously at the end of this will be recorded and my colleague Lynn Dudman will have that information, but equally you will see that when the PowerPoint is circulated, Rosie and Abby's details for any of the questions really are on there. So their contact details, their email address is available. Fran is saying, housing applications. Okay, I'm just having a quick look. Question for Hampshire County Council. How is DFG funding allocated to each district, please? I.e., how is the amount calculated, and what's the OT capacity generally like? Can either of you pick that question up?
Yeah, good question. So the funding comes from the Better Care Fund, and then is filtered down to each district from there. I think there is a algorithm on how much funding is given to each district, so I can have a look into that and maybe get back to you, Louise, on how that works. But I think it's fairly fair to say that it's not necessarily equal across all of the district and borough councils. And I think there is a big piece of work to have a look at how it's currently being spent, and then any recommendations on how it could be made better. In terms of your question around the OT capacity as well, it really depends on the current setup of each local authority, district and borough council. Some of them have OTs in-house, some of them use the Hampshire County Council ones. So it's a really mixed picture at the moment across the different areas. So probably if you wanted to access DFGs, it would be best to contact the district and borough council for that area that the person lives in, and then they would be able to give you the information around who would be eligible for each one.
Lovely,
yeah,
thank you very much.
Not a clear picture.
Yeah, that's really good. Thank you very much. I'm going to move on now. There's a comment from Caroline Winchurch, which I'll leave Abby or Rosie to pick up. But and also my colleague Biddy has come back and said, yes, there's still 40k available for families in fuel poverty. So again, bear that one in mind when you're thinking of referring an individual. Okay, so thank you so much, ladies. And I'm now going to move on to Ruth Gonsalves, who's from ABRI, who's going to give us a presentation around hoarding support in Hampshire and what's been achieved. So over to you, please, Ruth.
Hi everyone, yes, I'm Ruth. I am one of the housing managers for ABRI Housing. We're one of the social landlords in Hampshire. I used to, until very recently, chair the Hampshire Hoarding Forum, and I sit on several different groups around the Safeguarding Adults Board and the Hampshire Healthy groups. So I sit on lots of different groups and hopefully we don't repeat each other within those groups. So thanks for inviting me along, and thanks for Tim, Abby and Rosie for going first. It's always a bonus when you're not the first up. This is going to be a whistle-stop tour for hoarding. So please get yourself on some training if you want to know more, and definitely just drop me an email. So hoarding is the excessive collection and retention of materials to the point that the living space is not able to be used for its intended purpose. This is the definition we're using in Hampshire. So if you can't sleep in your bedroom and you can't cook in your kitchen, you can't wash in your bathroom, we would want to know about it, and we would want to get some support in there. It's a persistent difficulty in discarding of things, and it's now considered to be a standalone mental health disorder, and that's so if somebody goes to their GP now, you can be diagnosed under the Diagnostic and Statistical Manual of Mental Health Disorders as having hoarding disorder. It's not a lifestyle choice. It's when somebody's got so unwell they can't see that it's damaging. There are three main types of hoarding. There's compulsive and generalist hoarding. This is your TV show hoarding, really. This is where people are keeping old clothes, newspapers, food packets, any car parts, computer parts. This is the general, just general hoarding. So people would look and go, look at all this stuff. It tends to be that type of hoarding. Bibliomania is where people really need to keep any sort of information. So newspapers, DVDs, videos, magazines, articles. It's this real fear around losing information and not being able to get it if you need it, like wanting to be able to refer back to that article or that email, or you said this in 1934. It's about being able to pinpoint that information to prove a point. And lastly is animal hoarding, which is obviously really distressing for not just the person, but also lots of animals. It often starts as a really kind, generous offer, and it gets really out of hand, and then the person is not well and the animals are not well, and always need to involve the RSPCA when you come across animal hoarding. The general characteristics of hoarding, it varies per person, but there's this instrumental saving pattern. What if I or someone else needs it? It means so much to me, or I love it. The fear of losing it and then not being able to buy another one. It's a repetitive behavior pattern, so people get used to doing it and they repeat themselves, and there's comfort in that repetition of behavior, which can actually stop being comfortable and then becomes destructive to them and to where they live. It's very socially isolating hoarding. You can't invite someone around for tea if they can't get in the house. And there's this churning behaviour is often what we see when we're working with people that hoard, is that they say they'll move it, but actually what they don't, they just move it to another room, and they churn over it and over it again and re-justify why they need it. They may not see anything wrong with their behaviour, and they may have very little insight into why it's happening. So part of our role as professionals really is to go in there and help make some sense of the order. You know, people often say hoarding is a physical representation of what's going on in someone's head, and it's very cluttered and it's very distressing for them as well. So people can shut off from that distress by just saying it's not an issue, but equally some people can become incredibly distressed. So we use the clutter image rating. This is just the kitchen one, but we use the clutter image rating to try and sort of decide what needs to be done and at what level. So we would be looking as housing really in level 4 to 6 to be talking to that person and really starting to say, you know, balancing that support but enforcement action to say you need to do something about this, and encouraging that with regular visits. If somebody's 7 to 9, we would say professional help is needed. We'd be certainly encouraging, as Rosie said, with safe and well visit from Hampshire Fire, to make sure that we can see what the problems are, the safety of the people. There's a constant balance for supporting someone that's hoarding between support and enforcement. If somebody's hoarding massively in a flat, it's significantly higher risk than if they're hoarding in a home that's isolated on its own. So we really need to use this scale really to make a decision about what level of enforcement or support we need to put in place. As I was just saying, fire safety is massively important. The fire will spread significantly faster through a property that's hoarded. It's really important that Hampshire Fire know what they're going into for their operatives as well. So we want to make sure that they know before they go to that property that it's hoarded. So we would encourage those safe and well visits, but likewise, the housing associations would want to know, and we would want to support any other professionals going into that environment. We would always encourage a multi-agency response with hoarding. It's almost impossible to manage hoarding on your own, because you need fire to support the fire safety side of it. You need adult services at times, certainly if there's a capacity issue, or if the hoarding is relating to a medical condition, some sort of brain injury, or they physically just could not empty it. And so we always need to be able to get all the right people around the room. Environmental health, if there's damage to the property or there's any pests in the property, and we would really want any support agencies, but also there are specific agencies out there that you can pay to support somebody through their hoarding journey. One of the things we want, this is a whistle-stop tour of hoarding, so I appreciate I'm going really fast. But if you come across a property that is with somebody that's displaying hoarding behaviour, we want to gather as much information as possible. We don't want to judge the person. We don't want rational arguments. We don't want you walking into a room that's full of clothes and saying, well, you don't know where the white t-shirt is, because actually that's not helping. They probably don't, but actually we don't want to be, we want to be supportive, not cruel. And actually this is like I say, this is a physical representation of what's going on in their head. Therefore we want to unpick it slowly and carefully and respectfully, that this is often a fortress to keep them safe. We want to use those motivational interviewing tools, let them roll with resistance, let them tell us what's the problem, and eventually we can get to the bottom of it, but give the person the time. Be really honest and say that we may need to take some enforcement action, or somebody may need to take some enforcement action. Your landlord may take some enforcement action, but we want to balance that with support. No one is going to want to evict someone for hoarding. What we want to do is find that balance between support and enforcement, and get those relationships built again to help. Find out if there's friends and family, know what's available, know what services are available, who's got some money that we can tap into, who can we ask about this for support. So where we are in Hampshire, we were very aware that there was a high increase of hoarding cases coming to people's attention. So we've set up the Hampshire Hoarding Forum. This open invitation to anyone, please feel free to bring any cases along for discussion. We meet quarterly, and please send me an email, or I can get Joe Proctor, who's from Vivid, the new chair, and we'll get you along to that meeting. We've got the hoarding guidance on the Safeguarding Adults Board website, but again, you can just go into Google and type in Hampshire Hoarding Guidance. We really want to encourage a commitment to understanding what agencies do what, because what we can't do is say, oh, adult services need to just empty the property, they've got the budget, or Hampshire Fire need to empty it, because it just doesn't work like that. We need to understand who does what and what they can do to support the person. And really continuing to raise the awareness of hoarding behaviours and the fact that we can make some really positive changes for these people with them and keep them at the centre of what we're doing and support them through that journey. Ta-da!
Thank you very much indeed, Ruth. And I'll now tell you that there's over 70 of us present. Now you've finished. That was again, like Abby and Rosie. It was fascinating, the amount of information that you've shared, and the PowerPoints will be circulated. I've already seen some questions coming in, so luckily you're with us for the next sort of 10 minutes or so, aren't you? So I'm going to start quite quickly fielding the questions to you. So first comment is from Leslie, and if the person is if the person is an owner occupier, does it make it more difficult to support someone that doesn't want to do anything about it in terms of safety for others, or living in a flat or a terraced house?
Yes, it does make it more difficult because there's not a tenancy agreement in place that we can use and rely on. However, environmental health and the local authority do have specific powers to insist. So if a property becomes dangerous, then there's certainly enforcement that can be taken to ensure that it's made sound, so it doesn't fall down on anybody. And like I say, environmental health and Hampshire Fire both will go to owner occupiers and start to support that process to move forward. But people often bring cases like that to the forum where it's private and owner occupier.
Okay, thank you. Question from Joanne: what practical support is available for hoarders, as no one seems to want to help or can help, like housing associations or adults health and care will? Many people in this situation do not have the funds to pay for decluttering, and I think that's a common issue that I'm aware of.
Yeah, so again, I would really encourage anyone to bring cases, certainly that are housing association, to the hoarding forum, because most housing associations sit on there, and we can all have a little bit of a light-hearted competition to encourage each other to be doing the right thing. Certainly for our housing association, we do have a budget specifically for hoarding to support people. I know that Vivid do as well, and they also have support, emotional support workers as well, to help people through that journey. I feel that there's a lot of people that will say there's no money and they can't do anything, but what we try and do in the forum is come up with a real plan of saying we don't want it to all be adult services, but if they could visit once, the housing association visit once, Hants Fire visit once, and environmental health, you end up building up a picture of that sort of regular intervention to ensure that things start to move. But housing associations do have a duty to support those people within their properties to resolve any hoarding type behaviours they come across, and they have a duty not just for the property but for the person as well. So I would really encourage anyone that is having difficulties with housing associations to take responsibility to bring them to the forum, or email me, and I'm more than happy to chat individual cases through with somebody.
That's brilliant. I mean, is there a particular process when you say bring it to the forum? Is that through you, Ruth, or is there a particular generic email address that people need to email?
No, you just need to come along to the forum. So just email me. I put my email in there, and or we can make sure that Jo Proctor's the new chair, so we can make sure her email goes out after this with this, when it all goes out, to make sure that we've got her email address as well, and just come along. The really lovely thing about the forum is we've made it an environment where people can dip in and out. You don't have to sign up and come along for the rest of your life. Please just bring cases as and when, because actually that's the beauty of it. We want people to be able to bring relevant, tangible cases and what's going on right now. But in terms of getting money together, sometimes it's a case of, dipping in several pockets. So almost like the old school rehab funding, like getting a bit of money from here and there and getting a professional in. But equally, most cases we manage to keep away. We don't refer out to an agency. We would keep it in-house and get that multi-agency meeting together, get people around the table and who's going to do what.
Sounds brilliant. And I can see that Hannah on the Isle of Wight is already going to be coming back to you, because she's currently involved with a couple of cases, which is super. But there's a comment from Caroline Winchurch. Is there a place for adult mental health services within that you're talking about the multiple help and support.
Yeah.
Where do they fit?
Well, again, so adult mental health tend to just come along when they've got a case that is relevant. We don't have many people. We have quite a few people from Mind that come along and that sit there, and actually we've found that encouraging people to go to some of those groups with Mind, and not just with their mental health worker, that's been really supportive for people. But the groups tend to only be in the big cities, so like Basingstoke, Southampton, Portsmouth. So, but yeah, definitely come along, and there are other adult mental health workers that come along to that. John Harthill, he comes along.
Super. Okay, so the answer is generally yes, as and when needed. There's another comment saying that it appears that there's always been an emphasis on decluttering and the removal of belongings rather than addressing the actual underlying mental health needs or reasons for hoarding. Is that, do you feel that that's?
I think that's really absolutely was true, and I think there was a real emphasis from housing associations initially when this sort of came to light of, oh my goodness, it's a fire risk, we must empty their house. We know that that's incredibly damaging. Like I say, hoarding is a representation of what's going on with somebody emotionally. If this is their fortress and it's keeping them safe, if you tear it down, it's incredibly, I mean, lifelong damage can be caused by behaving like that. So everyone's aware that hoarding takes a really long time, generally speaking, to resolve. So I would hope that housing associations and landlords are aware of that now and are investing the time that is needed rather than just removing and getting an injunction from a judge to remove it. And in fact, now a judge would be reluctant to just give you an injunction to clear a house because they're aware they will often ask for what support measures have been put in place first. So yeah, absolutely, we want to get them supported. We want to get them into iTalk. We want to make sure they get into some groups and get that, the mental health side, absolutely. Otherwise, all you're doing is moving the problem. If you clear someone's house, they're only going to fill it again, or if you move them, they'll fill it there. So it's absolutely about getting to the root cause, which is 90% of the time some form of loss or trauma that someone's gone through. And we're not asking everyone to become counsellors or mental health specialists, but what we're asking is that people make the effort to find out who is best placed to support, and again, get those people around the table so that we can address each area in turn.
Thank you. And I'm going to take a final live question, and then if you've got a couple more minutes, just keep an eye on chat before you go. Tim Horton's asking, have you seen an increase in hoarding in Hampshire? Is there a trend at the moment?
I don't think so. I think hoarding's always been terrible. The research shows that in fact hoarding's been pretty bad on a level really since the war, since the Second World War, where people had this sort of must save or save and fix, you know, this idea that, you know, they've got 30 lawnmowers and they're going to fix them all. It's this sort of keeping things in case. And so there's a real generational that we've seen now that have got, you know, that we see coming through that have got lots and lots of very old bits that will never work again. But no, I think it's always been bad actually. And if you Google historical hoarding, then you get some incredible pictures of what people have hoarded over the years. So I think we are more certainly where there's an increased awareness of it now, and the increased awareness in terms of fire risk. And the TV shows, you know, this sort of the celebrity side of hoarding has really forced it through. But in terms of like, has it become more of a problem? I don't think so. I mean, it's just different. You know, people order things from Amazon rather than go to the charity shops or, you know, garage sales or whatever people used to do, you know.
It's moving the problem around in a different way. That's great. Absolutely. There's a question for you from Caroline, but I'm going to move on. So if I could ask you to do the honours on chat, Ruth, if that's okay, for Caroline's question. That's great. Thank you very much indeed. So Hanson Isle of Wight Social Prescribing Network, the Training and Development Survey. We're all having loads of surveys. You can never have too many surveys, but I just wanted to say, firstly, thank you very much to those of you that took the time out of your busy day to fill that survey in. Literally, it's sort of hot from the press, but what I've done is I've selected a few slides just to give you a flavour of the responses. So the one around immediate priority training needs, and obviously a number of you that completed this were operational colleagues, face-to-face social prescribers. So there's no surprises in some of the areas that you've said you need more support in: basic counselling, health coaching, community development, bereavement. There's a theme and a trend, and obviously it picks up on the theme of today, which is the pressures of COVID-19 that a lot of people are under. Support channels, I'm really pleased to see 17 out of the cohort said the Hanson Isle of Wight social prescribing. There was no money to do that, so well done, that's really good. You can see local meetings, the value of local meetings, and I know we're going to be looking at individual sort of group areas for particularly for social prescribers, the NHS England and other social prescribers, because currently you can see a mention of the South East Hants group. That's one sort of cohort, but what we're currently doing with colleagues from the Hanson Isle of Wight STP and from Hampshire County Council is we're going to be looking at how can we roll out more support in a more local way, because clearly you can see the priority is local, and sometimes local is best. What people want to find out a bit more information about, and we've got things like the National Academy of Social Prescribing. I don't know if Esther Watts is here today, but she certainly will be more involved, and we'll be sharing some more of the Thriving Communities information with yourselves. The National Social Prescribing Network and information again comes out from Lynn Dudman. So it's really good to see from that some of the information you're getting or you want to get is coming through the Hanson Isle of Wight Social Prescribing Network. Barriers, there's no real surprises in the barriers either. Lack of groups returning face-to-face. Yes, we now have a sort of a roadmap going out, which is wonderful and really positive, but I still think it will take months to return to face-to-face, and some groups don't exist anymore. So there's a lot of challenges still out there. Digital access, that one has been mentioned in previous webinars and it's not going anywhere, but the CVSs, a lot of the communities and the charities, they're looking at digital access and what projects and initiatives can be started to help people with those problems. Transport, and obviously transport can be interpreted in different ways. If you live in Gosport, it could be a peninsula, but also it could be a cost. We in this area where I live, there are 4 buses a day. So you can go out twice and you can come back twice. And after that, if you can't afford it, you can't go anywhere really. So that was just a flavour, and then you might say, well, what's next? Because we filled that form in, we took the online form and we completed it. Well, we have a steering group meeting coming up next week, and a number of decisions about future dates and things like that will be finalised. But what we're going to be doing is specifically looking, the first part of that steering group meeting is to look at the survey and to come back to you with a response. What support can colleagues from the STP, from Hampshire County Council, from the Hanson Isle of Wight Social Prescribing Network, combined, what support can we provide? So it's a watch this space. That was just a flavour really to say that you will be hearing from us as opposed to what's coming next really. So it's been a packed 1 hour. Can I just say, first of all, thank yous. I want to say thank you so much to the presenters. A lot of effort and time, rehearsals, timed rehearsals. You've all done fantastically today. And my colleague who sits behind the scenes, who without you wouldn't even get here, is Lynn Dudman. So I want to say thank you very much to Lynn. And without the 70 odd of you here today, it certainly would have been quite lonely. So brilliant turnout. It reflects the nature and the theme, I suppose, of today's webinar. You may not have had time to ask your question, or you might have thought of a question later. So please do email the presenters. We will be circulating all of their emails with the information next week. Do feedback via chat, either or to Lynn by email. This theme was suggested by Abby, and we adapted Abby Thwaites' idea, and we're wanting to say we're welcoming new ideas. So if you've got other ideas about webinar themes, we try to be quite comprehensive. We build things in, we try and respond to what you want. This is a membership network, really. I am sure that you have already planned your social prescribing celebration or PR for International Social Prescribing Day. It's Thursday, the 18th of March. Gosport Voluntary Action, for example, we have a social prescribing project called Community Compass, and I will be just writing a small article which will go into the local press. We'll be doing some social media awareness raising about the importance of social prescribing, particularly at this time. So I look forward to hearing some of your what you've done, some of your ideas, potentially between now and the next meeting. As I've said to you, the webinar and the PowerPoint will be shared, and it's available in about a week's time. So the dates I'm sure you all have now. 16th of June is probably in your diary. I've put it to be confirmed because I mentioned the steering group meeting, and I'm not quite sure when we will be returning to a face-to-face. It may be in September, it may not be. A lot depends on the next few months, but certainly a webinar in June, and then watch this space. But you do have the dates, so please put those dates in your diaries. And I would just like to say thank you very much for joining us. I want to wish you a very happy and healthy spring, and also a good rest of your afternoon. So you're now free to go. Thank you very, very much for joining us. And again, thank you to the presenters for your contribution today. And thank you for the comments. Thank you, everybody. Have a good afternoon.